Dave Johnson back at halftime. It is a special night. It is MedStar Heart Health Awareness Night here at Capital One Arena as the Wizards lead the Pacers 60-47. And MedStar Health is just doing so much to make sure that you stay healthy in so many ways, including heart healthy.
Our time now with Dr. Charles German, Director of Preventive Cardiology at MedStar Health. And yes, think about that, preventive cardiology. As Dr. Charles German explains,
it's a doctor that assesses your risk of having a cardiovascular event. So the idea here is to try to catch these people more upstream. So if you're able to identify someone that's at high risk of having a heart attack, say they have a strong family history, you can implement changes before they develop that heart attack. So really that's the whole concept, is identifying people that may be at high risk and changing their lifestyle habits, or maybe getting them on medical therapy to prevent that event from happening in the first place. Because once they've already had an event, it's almost too late.
Oh yeah, better to prevent something. So who should see a preventive cardiologist?
And so the ideal person that may want to see a preventive cardiologist is somebody with let's say a strong family history. Say, mom, grandpa had a heart attack when they were very young. I'm concerned that this is going to happen to me. What can I do to make sure that this doesn't happen to me? So we see a lot of people with a strong family history of heart disease. We may see people that have already had a heart attack or stroke and want to prevent another one, because we know that folks with existing cardiovascular disease are at a very high risk for having another event. There may be people with high cholesterol, and they're not sure why their cholesterol is high because they do all of the right things. Maybe it's somebody with high blood pressure, very difficult to control high blood pressure. Maybe it's someone at risk of diabetes and they're concerned about their cardiometabolic health. Oftentimes once you have symptoms, it may be almost too late, right? You want to start implementing changes even before symptoms start. Oftentimes when you're having symptoms, say chest pain, that means that you may have had decades of atherosclerosis building in your arteries, and that's time that potentially could have been treated earlier and prevented before you even started to have the onset of symptoms. So some of it is just having sort of the insight, going back to family history of knowing, okay, I want to get ahead of this before it's too late.
And important to note, with preventive cardiology, never too young to take control of your heart health.
Probably our first line of defense is to try to understand a 10-year risk of having a heart attack or stroke, and then a 30-year risk as well. And there's a calculator that's approved by the American Heart Association that takes into account your age, whether or not you're male or female, sort of your congenital risk factors, and it gives you again, a 10 or a 30-year estimated risk of having cardiovascular disease. And then dependent upon that risk score, if that score is high, you may want to start on therapy, particularly medical therapy. If that score is low, then that means that lifestyle may be all you need to do.
But time to take action now. Never too old, never too young. And this is Heart Health Awareness Month and Heart Health Awareness Night tonight, presented by MedStar. One way to start, as I've said, is take a free heart health risk assessment to learn more about your risk, and it's free. It's medstarhealth.org/yourheartrisk. MedStar Health, it is how we treat people. We thank Dr. Charles German for his time tonight. See, we're trying to keep you healthy. Healthy right now for the Wizards on the score, 60-47 on top of the Pacers. More in a moment on the Hulu Plus Live TV Washington Wizards Radio Network.